That's ridiculous. That sounds like they were trying to use you as a research monkey for experiments. That's what that sounds like to me. There is no need. That's ridiculous. First of all, you can't tell if a kid is autistic in the womb because you have to verify autism through observation, physical observation. That's ridiculous. That's impossible. Label that boy as autism. Put him in an autistic support class in kindergarten. So he's going to an autistic support class, but he's not autistic. Y'all simply got manipulated into signing him up for the autistic support class. After 1 year, guess what? Your nephew will be sounding autistic, talking autistic, acting autistic, because he's going to pick up the behaviors in the other autistic children. Don't fall for the okie doke, black parents. Hold on.
Hello?
Good evening, Sister Lauren. How are you?
I'm well. Oh my God, I'm speaking to you, Dr. Umar.
Yes, ma'am. How's Hartford, Connecticut treating you?
It's dangerous out here in these streets, so I live off in the suburbs.
I understand that. Go right ahead with your question, beautiful.
Yes, sir. So, I just had my lovely daughter in July, and previously, the doctor was trying to diagnose my child with having autism from the womb based off of some genetic testing that I didn't know I was signed up for. So how they got me was, you check in and you just click yes, hurry up and check in for your doctor's appointment. And one of the screens asked if I wanted to do or be a part of clinical trials. And I didn't know that was a part of my profile. Considering that I'm African American, I would have just clicked no. So that was on me for not checking. So we get the DNA results back. They were like, we want to do an amniocentesis. We want to invade your womb. And I was like, absolutely not. I had to curse so the doctors would stop asking to do an amniocentesis, which is where, they draw fluid from your placenta, which could rupture.
And they wanted to draw fluid from your placenta to see if your daughter was autistic in utero?
Yes, sir.
That's ridiculous. That sounds like they were trying to use you as a research monkey for white experiments. That's what that sounds like to me. There is no need. That's ridiculous. First of all, you can't tell if a kid is autistic in the womb because you have to verify autism through observation, physical observation. That's ridiculous. That's impossible. That is There's no.
The womb, fresh in the womb and then out of the womb as autistic. What tricks do I need to be aware of, especially because I follow a lot of your speeches, and I think you're right in terms of education is now going down the drain, especially since I'm a public school teacher, so I'm kind of on the inside, and I know it's going down the drain, and I'm just like, oh God, I got to find a new job. I have to figure out how to shift my life so I can homeschool and really mold and shape my child. So my question, thank you for listening, by the way. My question that I sent in was, what symptoms do I need to be on the lookout for as she develops and grows? And she's already advanced. African American babies, as you know, are advanced coming out the womb in terms of our motor skills, but we tend to fall back in terms of our vocabulary acquisition once we hit school. So what do you suggest I kind of focus on and develop for her skills heading into preschool?
How old is she now?
Oh man, my baby is only a month. So right now,
Woman,
education.
you don't need to be worried about no symptoms.
I'm nervous.
They
want my baby to have autism out the womb, so that's why I'm like, no, we got to do everything right now.
You know what I really wish? I wish I was a billionaire. If I was a billionaire I would airlift every mother and their newborn baby, be it a boy or a girl. I would airlift y'all to Africa, and y'all would spend the first 5 years of that child life will be spent in Africa, all expenses paid. Because our children are not even allowed to be infants. They're not allowed to be toddlers over here, because everybody's always trying to label them and classify them and diagnose them so they can get paid. It's all about the money. Nobody cares about black children. So when you see people trying to get you tested and diagnose your child and let's see if she got autism in the womb, that was an absolute fraud. It's for money. It's to hustle the children and use them for research guinea pigs. Nothing's wrong with your daughter. What you want to do, though, as she grows, is you want to overemphasize the literacy skills. So you want to make sure your daughter knows her letters, her colors, her sizes, her shapes. Put her in front of academic. Yeah, read to her letters, numbers, colors, sizes, and shapes. Make your home or her bedroom a temple of black beauty. And what I mean by that, she should see nothing on the walls in that house that don't look like her. No toys, no pictures. Everything she watches on television must look like her. Black children are going to be an alien everywhere they go in this society. We cannot afford for them to be an alien in their own homes. And too many homes that I go into, our children even feel like strangers in their own home because their parents got pictures of white Jesus, Marilyn Monroe, Bill Clinton, Barack Obama. None of the pictures look anything like them. The cartoons don't look anything like them. The toys that they play with don't look anything like them. The characters in the books don't look anything like them. Make sure you baptize her into her blackness. Remember, at that age, she's going to learn more about what she sees than anything else. The eyes are the most important sensory organ, in the ears as well, but especially them eyes. She's going to learn her world through seeing, touching, and hearing. And you got to make sure everything she sees, touches, and hears is racially affirming to her and her complexion. Very important that you do that. But I would read to her every day. I would start teaching her letters and colors and sizes right now, because our children are far more advanced than they give them credit for. Far more advanced. Your daughter will be able to memorize letters and stuff by the time she's 6 months. She could be reading by the time she's 2 years old, literally.
Okay.
So you just got to make sure you stay on that. Don't do the ghetto program, which is TV and toys. No, we're going to be doing books and basic facts. Get all the flashcards you can. You can go to the dollar store and load up on every type of flashcards you need, from the colors to the sizes to the shapes to the states. That's what you want to do at that age. Get them facts under her belt, because at that age, from now until 3, and then of course until 5, that's the perfect time to teach a child all the facts, because their brains suck it up real quick. And language as well. Language. You know, that's why we want to give her the books and the reading, and you want to read to her and show her the words and show her the letters and things like that. Make her playtime in her academic life all about academics, so it's fun to learn. See, the problem with us, the reason why a lot of our children don't have fun learning, we never included learning in their leisure activity. Their leisure activity had nothing to do with reading. Their leisure activity had nothing to do with writing, nothing to do with math. So when they go to school, it's boring and it feels like punishment, because all we do is give them footballs and basketballs and iPads and TikTok. And because we kept academics out of fun, our children associate academics with pain, and they associate academics with pleasure. One of the biggest differences between mentally gifted students and other students, one of the biggest difference between advanced placement children and other children, is the gifted children and the advanced placement children, they see school as fun. As fun. Other children see it as a burden. Make sure your daughter sees academics as fun as well.
Thank you so much for the download. I appreciate you. God bless you.
All right. Take care, beautiful.
Bye-bye. Hi, good evening.
Good evening, Sister Alicia. How you doing, beautiful?
Hey, I'm doing all right. Thank you so much, handsome.
All is well. How's Minneapolis treating you?
I'm doing well, but there's a lot of police
Yeah, the police still black folks like it's going out of style up there.
Yeah, I heard my uncle in 2017.
Sorry to hear that.
Lockup. So yeah, it's starting to be like business as usual here. It's just starting to be the new normal. You know what I mean?
Yes, ma'am. Yes, ma'am.
Actually.
Yes, indeed. Go right ahead with your question, beautiful.
So my question is, so my nephew, Dave said that he's autistic, and we didn't know right away. We didn't see the signs right away, and so.
How old was he when he said he was autistic?
5.
Kinda young. How old is he now?
Well, he's 5. It was this year, and we do see a lot of signs and things going on with him. So we're pretty confident of the diagnosis, but we're gonna wait and see what the school says and all of that.
Please wait, because remember now, in order to qualify for special ed, there must be disability plus impairment in learning. So even, let's say he is autistic for the sake of conversation, he's autistic. He cannot qualify, nor should he qualify, nor should you want him to qualify for special ed service unless that autism affects his ability to learn in the classroom. You follow me?
Yeah.
We don't want him with an IEP if he don't have trouble learning. Special ed is for learning. If he's only autistic, autism is not a learning disability. It's an impairment in communication. Verbal and nonverbal, spoken and received, expressive and receptive. So,
yes.
Let's say he has that. But if he gets in that class and he tears through that academic work and he's at the top of the class, why would there be any conversation about an IEP?
Right. That makes sense.
Now, if he needs social skills training, then I would probably look for that outside of the school setting through the Association of Black Psychologists or through a private therapist or a licensed clinical social worker. He can get his social skills training from another professional. But I would not put my autistic child in special ed just so he can get social skills training, because he's not going to get much of it anyway as a black child in Minneapolis public schools.
So if he has issues with, social skills, do you think that kind of bleeds over into the area, the realm of like trying to teach him something and him not picking it up?
We will not know until we see, which means this is going to take me back to the previous caller or 2 callers ago. Remember, I told her we want to be very careful not to try to predict problems. When you try to predict problems, you make problems. I never try to predict, and I'm an expert evaluator. I never try to predict problems for a child. You follow me? I want him in the class, and I want him to show us what he can do. And if y'all start seeing severe problems the first week or second week, so be it. Call an IEP team meeting and say we need him evaluated for autism. We believe that his autistic symptoms is affecting his ability to learn in the class. But to try to make that decision before you have given him a chance to show you is unfair to him. You see what I'm saying?
Yeah, and so that leads me into my next question. It's a great segue. So the next question is, say it works out where they say his autism is affecting his learning now, and they come.
Well, first of all, I don't care what they say. You better believe it as the parent or the auntie,
right?
Because schools will tell you anything. You know, these teachers today, the minute a child struggles, they want them tested for special ed. My whole career, I've had to fight white women to tell them that this child has no business getting tested for special ed. Well, he's not picking up as fast as the other children. He don't have to. He's not the other children. He might be a slow learner. He might be a step behind. He might be developmentally delayed, but he doesn't have a learning disability. How about you try teaching him first before you send him to me for an evaluation? You see that? So I don't care if the teacher says he's having trouble learning. Y'all better believe it yourself. Remember, he's a black boy. Don't put hindrances on him that he did not prove to you he has.
Got it. So I guess what our worry is too is that they always say the earlier you intervene, the better.
That is not true for autism. That is true for cancer. That is true for diabetes. That is true for blindness. That is true for heart disease. That is true for kidney failure. That is true for HIV/AIDS. That is not true for autism, because autism has no cure. It literally has no cure, not no known cure at this time. So whether you diagnose autism at 3, diagnose autism at 5, or diagnose autism at 7, he's the same child. There's nothing that's going to change the fact that he's autistic. And I would even argue the opposite is true. And what I mean by that is this. Label that boy as autism. Put him in an autistic support class in kindergarten. So he's going to an autistic support class. But he's not autistic. Y'all simply got manipulated into signing him up for the autistic support class. After 1 year, guess what? Your nephew will be sounding autistic, talking autistic, acting autistic, because he's going to pick up the behaviors in the other autistic children. So let me ask you a question. Which way do you think would provide you a better opportunity to determine if he's autistic or not? Being around regular kids in the regular class, or being around autistic kids in the autistic class? Which setting do you think gives you a better opportunity to really discern if he's autistic or not?
I think the first one, the option you just said.
The regular classroom. Absolutely. Absolutely. So if you let them put him in an autistic support classroom,
he's going to behave that way.
Exactly. You won't know what's him and what's social learning. You will not know what is he doing is simply him, and what is he doing as a reaction of picking up on what all the other children is doing.
Now, how would you tackle the echolalia, like just repeating things that he's hearing, but he's not really processing? Processing this, like when you talk, it's like, it's a transaction. When you say something, I respond. Like grasping that. Is that still something that speech delayed kids can have issues with?
Does he get speech?
I'm sorry, you say that?
Does he currently get speech therapy?
Yes.
Okay. What did the speech therapist say about that issue?
They're just working with him on it, trying to get him out of, doing that.
I'm going to say this. Most speech and language children, and I'm not a speech pathologist, but most speech and language children in our community, they get horrible service. They get horrible service. They only get about 30 minutes a week, if that. They might get an hour a week, if that. If I were you, I would contact the African American Speech and Language Therapists Association, and I would get some referrals from them for some speech pathologists in your area. And I would pay out of pocket. You could check with insurance. They might cover it. But I would pay out of pocket for him to get an extra hour a week of speech therapy. If we rely on Minneapolis public schools to correct his speech issues, we might be waiting for the rest of his life. Do you feel me?
Yeah.
Get him some extra therapy. My youngest daughter, who's 12 now, when she was about 5 or 6, her mother had her at this Quaker school that I didn't agree with, but she's a bourgeois, so she did it anyway. But the white folks up there said they thought my daughter had a speech and language impairment. I told my daughter's mother she's not getting tested by the school. We're going to get a private speech pathologist to test her. And if she's determined to have a 25% delay, because that's normally what they look for, we're going to pay for private speech therapy. She's not getting it from the school. And this was at an expensive private school. I still didn't want it from them because I know how horrible speech services are given to black children. Occupational therapy services are given to black children, and physical therapy services are given to black children in the public schools. Those are three very poorly given services for black children in public schools. So if you want it done right, you want to pay for it out of pocket.
Okay. Okay.
Let me ask you another question. Has he ever had an audiological evaluation?
Yeah, he did. He went through everything when he was younger. He went through everything. We were trying to figure out what was going on because we started seeing signs of like delays and just, delays in processing and other stuff. And so we got everything done and everything came back. He can hear, all of that. Everything's working. It's just that that's what they came up with, saying that it was.
And let me also say this to you. There is no therapy like time itself. I'm not saying wait forever, but at 5 years old, we need to be kind of patient with him. He's 5. Okay.
They offered another therapy too, where they said it was a rigorous therapy for kids if they have autism, or they just drill him 8 hours a day. Do you think that's a good idea? Like,
I'm gonna tell you what I'm gonna give you first of all, when they use the word rigorous, they don't really mean it. That's just a word they use with black parents to sucker you into signing your child up for the program. They don't care about him. They care about the money that comes with him. They don't care about him. They care about the money that comes with him. Calling the program rigorous means nothing. That's just the way to sucker you in. And once you get him labeled as autistic, just so he can access that program, I want you to call me back up and tell me how effective that program is. You're probably going to be telling me it's not what you thought it would be because it's all about the money.
Yeah, it's called ABA therapy.
Yeah. Applied behavior analysis. I know all about it. And it's only as good as the particular therapist operating that particular program. It's a hit or miss.
Oh, okay.
It's a hit or miss. What are the autistic symptoms that y'all seeing?
So the echolalia, sometimes he's in his own little world talking, and we have to get him out of the world and get him back to talking with us or paying attention to us, but he'll go into his own little world. The way he, sometimes he'll communicate by repeating phrases off of the cartoons, and then we'll have to think about what was going on in the cartoon to understand what he's trying to say to us.
Okay.
You know what I mean?
I follow you. I'm going to say this. If y'all do decide to make him autistic for the purposes of accessing that program, the minute you come to determine that he's no longer autistic, make sure you exit him from special ed immediately. All you have to do is call an IEP meeting and say, he no longer needs these services. He can learn in a regular classroom. Please exit him immediately. And make sure you sign the papers to exit him. Because what schools will do is they will tell parents we're going to exit him, but he's still on the paperwork for special ed, which means they're still getting paid. If you don't sign that exit form, they're still getting money for the child.
Oh, good point. Thanks for mentioning that. Yeah,
okay, just know that you can exit him because I kind of feel like you want to give it a shot. I'm not going to tell you not to. I don't think I would. But if you decide to do it, just know the minute this is no longer working out or the minute y'all realize that he doesn't need that, you can call an IEP meeting and exit him from the service.
Okay, yeah, we're going to do what you said. We're going to wait and just send them to school, not say anything, and let them tell us so that they're not biased, so it's not a biased observation that they give us.
Right.
But I'll be really quick. One more thing. So we were told if he is autistic, because he hasn't, there's some certain skills that you have to learn by the age of 6, and if you don't learn them, then you'll never learn it. Is that true?
No, I never heard of nothing like that in my life. That's ridiculous.
Okay, because that really had
certain skills, if you don't learn at 6, you won't learn them. There's people who didn't learn to read until they were 60 years old. So what skills, if you don't learn at 6, you won't learn them. I'm not aware. If you ain't walking by 6, you can still be walking by 16. So what skills are they talking about that if you don't learn them? See, that's the type of fear mongering they love to do with black parents to try to coerce us into signing our kids up for these programs so they can get their money. There is no skill I know of you will not learn if you don't learn it by 6.
Yeah, it was one. They told us it was a speech portion of it, and we were so totally disillusioned when we heard that.
Nah, that's nonsense. Absolute nonsense.
Okay. Well, thank you so much for confirming that. They gave us a lot of hope and helps us to, feel like we can still, work with him.
Don't let them hustle that 5-year-old boy. Don't let them hustle him.
Yeah.
Give him a chance in that regular class and let's see what he can do when he walks into kindergarten.
We will do. Scouts on their promise.
All right. And you got my number so you can reach out anytime.
Yeah.
Okay, beautiful. Have a good one.
Thank you.
All right. Now. Black parents, before I go to the next call, black parents, please slow down. Slow down. Stop looking. They done brainwashed us into getting all of our kids labeled before kindergarten. They literally got us thinking we are helping our children by labeling them before kindergarten. Look how paranoid we are. I'm not talking about the callers. I'm just speaking in general, y'all. Please, please don't fall for the okie doke, black parents. This is all about money. Money, 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 money. Let me go to Brother Terrell in D.C.